Do you remember that case of polio detected in New York last month? Some fear it may have been the tip of the iceberg. The virus has now been detected in wastewater in 2 different treatment plants in New York. And the strains of the virus are the same strains from cases that cropped up in the UK and Jerusalem. Health officials are now expressing concern that there could be more out there. So far, the only confirmed case was that first one I mentioned, detected July 21st. That man was from upstate New York, and he was not vaccinated against polio. He eventually needed to be hospitalized and did experience some paralysis. Also concerning is this part of New York has really low vaccination rates in children when compared to the rest of the state. And kids generally get the polio vaccine when they're young. Polio also happens to be highly contagious. Joining us live to talk about it right now, Dr. Amesh Adalja. He's a senior scholar at the Johns Hopkins Center for Health Security. Amesh, thank you for stopping by to chat with us live tonight.
Sure, thanks for having me.
So let's start with how dangerous this is. We've been talking about it a lot in the news lately, but for those who aren't vaccinated against polio, they should be taking some extra precautions, especially compared to those who are vaccinated, right?
Right. The way that we obtain polio, including vaccine-derived polio strains, and that's what's occurred here. So it's important to draw the distinction between wild polio and vaccine-derived polio, is being vaccinated. The fact that this happened in Rockland County is not surprising to me. That's a place in New York that has a very low vaccination rate. It was the epicenter of a measles outbreak just prior to the COVID-19 pandemic. But if you're vaccinated, that's the best way to protect yourself against polio. This is one of our most heralded vaccines, where Jonas Salk had ticker tape parade. So it's sad that we're seeing the levels of polio vaccination decline in the United States.
You mentioned vaccine-derived polio and wild polio. Without getting too in the weeds for our viewers, what's the difference between those two and why does it matter?
Well, it matters because wild polio is the actual natural virus, and that really only circulates in Afghanistan, Pakistan, Mozambique. Vaccine-derived polio is actually one of the rare side effects that occurs with the Sabin polio vaccine. Remember, there were 2 different vaccines. The Sabin vaccine was the one maybe you got on a sugar cube that you took orally. In rare cases, that vaccine virus can mutate, and it usually doesn't cause a problem. But if it infects an unvaccinated person, it can then lead to paralysis. It's a separate problem, but it's the reason that we have these issues is because much of the world still uses the Sabin vaccine because it's easy to give. It's an oral sugar cube. And so long as people are giving that, we're going to have some level of vaccine-derived polio. And the way to stop that from happening is to have everybody vaccinated against polio, so this is not an issue.
Knowing what you know about that community, you said it's been the epicenter of other outbreaks. Do you expect, in your professional opinion, that there is some substantial number of unknown cases in New York right now?
Anytime you see a paralytic case related to polio or vaccine-derived polio, you have to realize that that's the tip of the iceberg, that there are many cases. Only about 1 in 100 cases is going to lead to actual clinical symptoms and paralysis. So that means there probably are more, especially in a place where there are low vaccination rates. And I think that's what the wastewater surveillance suggests. That this is likely something that is spreading in that community. And the way to stop this is to get more people getting the Salk vaccine in their arms. And I think this is not surprising, as I said, that this is occurring in this same county where we had major measles outbreaks a couple of years ago.
You said just 1 in 100 end up paralyzed. So what other symptoms and how quickly do they come on for someone that might have polio?
There aren't really that many symptoms. Most people have inapparent infection. They don't even know that they're infected with it. It's such a rare complication, but it's a very severe complication when someone has paralysis. But it doesn't represent what the virus or the vaccine-derived viruses do in most people. But when it does occur, it's so dramatic that people may have paralysis of their respiratory muscles, a paralysis of their legs. This is not a disease to fool with. This is why we made such an effort, the March of Dimes, to make a vaccine. And this is something that's been eliminated from many parts of the world. And I think that we really have to underscore the fact that we live in luxury, that we don't think about polio, but it's only a couple of low vaccination rates counties away from being an issue in certain parts of the country.
All right, Dr. Amesh Adalja live on Prime for us tonight. Thank you so much for sharing your expertise.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.